Hello, my name's Alan Kerry. Welcome to another podcast from South Essex GP Training. With me I have Sunil Gupta, and we're going to talk about mistakes in general practice. So Sunil, can you give us some examples of the types of mistakes which can be made in general practice?
So 10 real cases of mistakes which I've come across in general practice are: case 1, a GP prescribed a beta blocker to asthmatic and that patient subsequently died. Case 2, a GP prescribed penicillin to a patient who had a past history of severe allergic reaction to penicillin. Case 3, a clerk filed a blood result in the notes of a wrong patient who had the same name but a different date of birth, and that resulted in incorrect treatment being given. Case 4, a GP printed out a prescription from the computer of the correct drug but for the wrong patient. Case 5, a GP printed out a prescription from the computer for 1,000 ibuprofen tablets instead of 100. Case 6, a practice nurse gave several patients a tetanus vaccine rather than the flu vaccine. Case 7, an elderly man presented with increased wind PR but no other symptoms. The examination was normal. The patient was reassured, but 3 months later the patient presented with metastatic bowel cancer. Case 8, a GP wrote a prescription for Depomedrone rather than Depo-Provera. Case 9, a GP arranged an ECG for a patient with mild chest pain for the last few weeks. On looking at the ECG, the GP missed the Q waves and wrongly reassured the patient. And case 10, a GP gave a patient a letter for a private referral to see a dermatologist about a probable melanoma. The patient did not make the appointment, and the GP only realised when the patient came back to see the GP 9 months later.
Is it correct to say then that in the examples you've given, the two big themes that seem to stand out are communication and prescribing?
I think that's right. So for example, case 1, if we talk about communication mistakes, was case 1, the doctor not knowing the patient was asthmatic. In case 2, the doctor not knowing the patient was allergic to penicillin. In case 7, the doctor not telling the patient clearly what symptoms to look out for. And in case 10, the doctor not telling the patient clearly the importance of the referral. So those were the communication mistakes. The prescribing mistakes were, in case 1, the wrong drug being prescribed because it was contraindicated. In case 2, the wrong drug prescribed because of an allergy. In case 4, the wrong patient. Case 5, wrong quantity. And in case 8, the wrong drug being prescribed because they sounded similar.
So what are the causes of these mistakes?
Well, one way to look at it is you can have system errors, patient factors and health professional factors. So system errors can be things like allergies not clearly marked, similar names of patients not highlighted, diagnoses e.g. asthma not clearly marked, injections looking similar, other things which make a difference in terms of having a culture of blame, so mistakes aren't learnt from, and also people being scared to question the action of the so-called superior. In terms of patient factors, the patient has a role as well in terms of in terms of their communication skills and in their ability to explain what's wrong with them, in terms of them not reading patient information leaflets and again being afraid to question the action of the doctor. And the health professional factors can be things like lack of knowledge in the health professional, poor communication skills, tiredness or lack of sleep or stress in the health professional, physical or mental illness, poor handwriting, which especially used to be important in the past, having a consultation time which is too short, being afraid to admit when being out of their depth, and not being willing to seek or listen to the advice of others.
So what suggestions can we make about how to reduce the number of mistakes made in general practice?
There's a number of suggestions we can make, and I'm not suggesting this is a comprehensive list, but things like making all staff aware of common mistakes, trying to shift away from a culture of blame, ensuring important diagnoses and allergies are clearly visible, making medicines easier to distinguish from each other, GPs having a system to track patients that they're concerned about, e.g. writing down in a diary somewhere or in electronic ways so that they know that in a week or two that they'll go back and make sure that patient has come back or that blood result has happened or to make sure the referral has happened. Check the prescriptions you print out. Do one thing at a time. Ensure regular maintenance of equipment do regular significant event audits discussing mistakes, avoiding excessive working hours, and another thing which may help is things like communication skills training.
Thank you, Sunil. So in conclusion, to reduce the number of mistakes in general practice, we need to be aware of the common types of mistakes. We need to move away from a culture of blame and try to address the systemic factors which affect patient safety. Thank you for listening to this podcast. We hope you'll try some of the other podcasts on this website.